Hi, I'm Eric Wood. I direct the Occupational and Environmental Residency program at the University of Utah, Rocky Mountain Center for Occupational and Environmental Health. I want to spend a little bit of time with you giving an overview of our program, some of the aspects that make it unique, that I think make it one of the strongest programs in occupational and environmental medicine in the country. Our program, like all programs, consists of 2 years of dedicated training in occupational and environmental medicine. One of the most unique aspects of our program is our Masters of Occupational Health. So I do want to spend a little bit of time talking to you about features of that I think really make it a very powerful exposure to the fundamentals of occupational medicine that you will use to drive your career forward and really help for you to excel, as well as benefit from the really deep training that you'll get. So in our program, residents start the MOH in the summer, late summer, early fall of the first year program. Residents come in on July 1st, like in most training programs. They have about 8 weeks of training at either our clinic or other specialty clinics, and then they begin the academic phase focus of training. The MOH was designed by our faculty in 2009 to address what was at that time we thought to be some deficits in most academic training programs. Previous to that, we'd had an MPH program within our own department in our public health program. But what we had learned from our residents, our graduates and alumni, as well as just our own survey of the field, was that some of the key portions of education were really difficult to deliver in that period of the MPH training. There were some issues going on with how the Council of Accreditation of Public Health were expanding curriculum and really potentially limiting some of the opportunities for that training in occupational environmental health. So what we ended up doing was developing a new curriculum based on feedback from alumni, current residents, as well as a survey of the field at large, as well as looking at really the data that was out there on what was demanded by the marketplace. Some of the big changes we did that are currently and continue to provide that background from our residents are inclusion of specific courses in toxicology, ergonomics and safety, occupational epidemiology, and a management course that was really designed over the curriculum developed by our former mentor, Dr. Royce Mosier. One of the other aspects of the curriculum is that we have dedicated courses on occupational injury disease, as well as on clinical preventive medicine. Another unique aspect of our graduate program is that all of the courses are taught internally by our faculty, either by our occupational medicine faculty or by our occupational epidemiologists, our ergonomic specialists, or our industrial hygienists. What's really powerful, I think, for our residents is that these courses are taught by people working directly in the field, academics that really focus their career on occupational environmental health. They're also taught in-house so that they're actually performed at our Rocky Mountain Center or at our industrial hygiene or ergonomics departments in the University of Utah. And they're small classes with all of the interdisciplinary specialists in our field of occupational health. So our residents work alongside the industrial hygiene students, the ergonomics and safety students, and the occupational injury prevention research training students in either master's or PhD programs. It allows our faculty to tailor lectures specifically to occupational health needs, and it allows our faculty to change up to the moment of when the lectures are given to base on contemporary science and contemporary changes in state-of-the-art care. I think one of the things that we've learned in these training courses is the residents really do get to work in interdisciplinary nature with the other colleagues in the field and bring the strengths of medicine to the field, as well as learning about the strengths that the other disciplines that you will work with throughout your career bring to the table as well. I think it really helps develop the nature of working in teams in our occupational health specialists to deliver the best care to patients and to populations of workers throughout your lifespan. One of the other kind of unique courses that we have is in the spring semester of the last year that the resident of the academic portion, residents work with these interdisciplinary teams doing our core course, the Occupational Safety and Health Solutions. A couple things happen here. One, you get to work with students at designing a real solution to a problem brought by industry partners throughout the region, but it also gives you a chance to generally get between 6 to 8 site visits at various levels of occupational health sites throughout the state. We do site tours throughout the residency training program, but this is a real dedicated focus towards working at different industries throughout the state, and again, coming up with a solution to a problem raised by our partners in the community. So it has real world practical implications, and it really develops the opportunity to how a consultant in occupational health would work with clients to address their needs and write a report that is effective and valuable for those companies. In this period of time in the MOH year also, you're going to get introduced to our research program. We start that in the occupational epidemiology class, and then it continues on in the spring semester with the research focus course as well. You'll have the opportunity to develop your own independent hypothesis-driven research, and we'll talk a little bit more about what kind of research activities we do here at the Rocky Mountain Center later on in my discussion with you. But as that research course comes around, you'll develop the tools for developing a hypothesis-derived research, working up the analysis through the tools you learn in the academic portion. And then ultimately our goal is that you'll be able to present an abstract for presentation at our national conference, and then in turn write that up in a publication that you can get published, that we would like to have a publishable paper by the time you graduate. So anyhow, the first 2 semesters of the first year of training are a lot of the time is focused on this occupational foundation coursework and the Masters of Occupational Health degree. But throughout the entire period in the first year, you're working in a continuity clinic with our faculty at one of our 2 occupational medicine clinics within the university system. The residents at the beginning of time, starting on July 1st, will initially, after orientation, will start their practice with our faculty in the South Jordan Health Clinic, where we'll be seeing a variety of occupational health injuries as well as preventive screening type exams. Again, kind of focusing on our faculty, we do have 8 occupational board-certified occupational medicine faculty. And one of the things that's also very unique about our program is that we have, as one of our primary products, is development of the American College for Occupational and Environmental Medicine Practice Guidelines. Our center director, Dr. Kurt Hegman, is the editor-in-chief of that volume, the compendium. It really is considered the state-of-the-art care for occupational medicine practice. We have a team of dedicated research staff that help develop the research and collate the literature that we use for development of these guidelines. This is a national-based, international-based, really, consortium of volunteer specialists, academicians, as well as people working in private practice, to develop and really produce this state-of-the-art practice guidelines. So why this is important for us is that all of our faculty have some involvement in the ACOM practice guideline production. Many of us have been editors of different organ systems used for the practice guidelines, and then we all become expert in the application of those guidelines at our clinical practice. So one of the things that we pride ourselves on is that in your training in occupational medicine clinic practice, you will have the state-of-the-art guidelines and practice and implementation of those taught by experts in the field on your day-to-day basis. We spend a lot of time in our clinics working with residents at making sure that we follow appropriate state-of-the-art care in terms of the diagnosis, the differential diagnosis, the testing that would be appropriate, and then accordingly management plans. So again, we've got 2 clinics, the South Jordan Health Center and the Redwood Health Center, that are close to the proximity of our center that residents will spend time at. So in the first year of training, you'll have dedicated weeks of time at both clinics, and then you'll also have the continuity clinic that goes on throughout the entire year. In the second year of training, the OEM 2 year, all of our residents will spend approximately 12 weeks of time at our occupational medicine clinic, sequenced at a kind of split throughout the year of beginning, middle, and late phase of training, where you'll complete the you'll develop your expertise in occupational medicine practice such that towards the end of the stage of your training, you're going to be ready to independently practice at the top of the game for clinical practice of occupational medicine. I want to talk a little bit more about other aspects of the first year of training. So we have our MOH, we have the continuity clinic, and we have a series of elective rotations that also come into play there. So the elective rotations, we break them down, and this occurs in the second year of training as well, is we'll have either clinical-based rotations, industrial-based rotations, or population-based rotations. So our clinical rotations, the foundation would be at the occupational medicine clinical practice at the University of Utah. One of the other aspects of training at the University of Utah is that we really do have one of the top-tier medical schools in the nation. And in that, we have residency programs that span the entire spectrum of specialty training throughout the practice of medicine. University of Utah, I think we can easily say is a very collegial institution for learning. Our residents are incorporated into any of the specialties where they go do their additional training. And I think what you'll find is that the faculty are generally very welcoming, very respectful, and as well as are the other residents training throughout. So kind of the main clinical rotations, specialty rotations that our residents will spend time with would be the areas that we focus on in our clinical practice. So you'll spend time with orthopedics, you'll spend time with pulmonologists, you'll spend time with dermatologists, you'll spend time with ophthalmologists, you'll have opportunities to work with physical medicine specialists, physical therapists, audiologists, really all of the appropriate clinics that we see, clinical type patients that we see in our practice. We want to have that opportunity to work with those subspecialists as well. The training will occur typically at the University of Utah or our Veterans Hospital, which is also staffed by University of Utah faculty. Both institutions are really close proximity to one another within walking distance. So we have excellent population of patients to work with and faculty that are really expertise throughout. And most of the faculty have long-standing knowledge of our occupational medicine needs as well. So it really turns out to be an excellent opportunity for that. So in addition to the clinical training, we have lots of opportunities for industrial or corporate-based training. Recently, we just started a rotation at Cummins Diesel that's staffed, precepted by one of our alumni, Dr. Bob Chestnut. Residents have really been thrilled about the opportunity to learn about the broad spectrum of what practice in corporate occupational medicine is with Dr. Chestnut. We also have opportunities to work regionally at the Idaho National Lab, which is one of the Department of Energy sites. It's a really unique niche within occupational medicine, and again, it provides some of the real broad-based training as an occupational medicine specialist working in that domain would be. Residents will also rotate at Hill Air Force Base, which is a close commute about 30 minutes north of us. And again, seeing essentially there, it's a place where they refurbish different fighter wings. So it's almost like a manufacturing facility where a plane will come in, get taken apart, and put back together again. So all of the big industrial aspects of that come into play, whether it's ergonomics, whether it's chemical hazards, or whether it's routine screening evaluations for hearing, for metal exposures, for you name it. One of the other powerful rotations that all of our residents typically will do is working with our Workers' Compensation Fund insurance company. One of our faculty, Andy Phillips, is working at Workers' Compensation Fund, performing review for them as a physician reviewer. And really what's unique, all states will have workers' compensation carriers of resort for all of the employers in the states where you would end up practicing, but most follow very similar guidances. And so this experience is really valuable for learning what it is that insurance companies who are going to be the payers of your patients are looking for appropriate care of their patients. So Workers' Compensation Fund actually follows the ACOM guidelines for determination of whether or not a disease is appropriately treated, injury or disease is appropriately treated, and what kind of guidelines should be followed. So Dr. Phillips works with the residents to help guide them through review work, and you get to learn what it is that is important to include in your notes, what it is important to diagnose, how it is working with the insurance companies to make sure that your patients get cared for. The other important aspect of it is you'll learn, is that unlike private primary health care insurance, workers' compensation insurance, because their clients are because care of their clients includes reducing medical costs, they have really a fundamental need to reduce risks at companies. So they have teams of specialists in occupational health going to work with clients to help reduce those risks. And that'll include industrial hygienists, safety specialists, nurse case managers, physician reviewers. So what you'll learn there is the actual preventive aspects from an insurance company's perspective of how can we reduce the risk at this site so that we don't have as many injuries that we have to take care of, essentially. So the Workers' Compensation Fund is another very unique rotation that we have for our residents to work on. A couple of the other places where residents will often go would include NASA. Residents will leave state for typically 2 to 4 weeks of time to work at Kennedy Space Center in Florida. And then sometimes there's opportunities to go to other federal sites as well, including Puget Sound Naval Shipyard, which is unique in terms of the exposures compared to the Hill Air Force Base where they're dealing with aircraft. We also have a lot of focus of time on population-based rotations. We have the federal sites at OSHA and NIOSH. The OSHA rotation has turned into more of a remote rotation. The teaching there is excellent. It occurs at other institutions as well, but you really get a sense for what happens from a regulatory standpoint of management of occupational environmental health concerns. The NIOSH rotation, National Institutes for Occupational Safety and Health, is usually based out of Cincinnati, Ohio. That also is being turned into more of a virtual distance-based rotation as well. Some of our residents have taken time at the facility in Morgantown, West Virginia, as well as the facility in Anchorage, Alaska. And there you're going to be learning about more primary research that's going into occupational environmental health concerns, as well as potentially doing what's called a health hazard evaluation, where you're actually doing a field site investigation, shoe leather type epidemiology for a potential outbreak of a new disease or review of something that's occurring, whether or not there's a increased pattern of injuries or illnesses at the facility of question. Within our own state, we have similar entities as they do at the federal level. So our residents will typically rotate at the Utah Occupational Safety and Health Administration, find out about delivery of the aspects of OSHA within a state-based system. Most of our residents will spend time with the Utah Department of Environmental Quality, and there you get to look at community-based aspects of environmental health concerns, from review of hazardous waste sites to hazardous waste incinerators to underground storage tank issues to asbestos abatement issues. So things that are monitored and regulated on a state basis that, again, our alumni often go on to working in these types of roles. And then also you have the opportunity to work at the Utah Department of Health and looking at global health concerns for the state-based population review. A lot of times residents end up working on issues of air quality, for instance. And then finally you have opportunities to work at the county level as well for the Salt Lake County Health Department, working in those preventive aspects as well. So over the kind of the latter part of the first year of training and throughout the second year of training, you have the opportunity to work at all sorts of different clinical, industrial, and population-based sites to round out your education. And that's one of the things we really want to emphasize for our residents is you can go on to any myriad occupations once you leave this field within our specialty. And we want you to have the skill sets, the exposure, and the foundation of learning to be able to go on to be the expert in the clinic that usually you're going to get hired to become a medical director for. Or you can get hired on to a corporate site where you can, gradually develop your expertise, where you can become the corporate medical director for a large institution. And then finally, you can go on to work in population-based health, whether it's something like NIOSH or OSHA, or whether it's state-based or county-based programs that are also dealing with not only occupational health concerns, but even general population concerns, general preventive medicine aspects as well. We've had alumni go on to all these types of positions, really excel at them, and I think the opportunities to kind of move from one to the other is also one of the things that make our specialty so unique and keep our people in our specialty as happy as they are. I wanted to talk a little bit about what research activities go on here at the Rocky Mountain Center. We do have a really large faculty and growing faculty. So we've got 8 occupational medicine faculty. We've got specialists in epidemiology. We've got specialists in occupational health psychology. We've got specialists in ergonomics and safety. The main focus of work that we do at our center is focusing on musculoskeletal disorders, back, shoulder, knees, things that really impact populations at large and really have a huge economic as well as impact in terms of the morbidity and mortality of workers in occupations throughout the nation. More recently, we've begun through Dr. Sarang Yoon, our Associate Program Director, significant amount of work in vaccine-preventable diseases. Much of this came out of the pandemic, so we started out doing a lot of research within prevention of COVID, and then that's expanded on to more broad-based vaccine-preventable diseases. And then we have a couple of populations that we have spent a lot of time focusing on prevention and reduction of mortality as well. Primarily working with truck drivers and firefighters to help the unique aspects of each of those occupations and, again, reducing overall morbidity and mortality from work-related as well as personal risk factors associated with those. Some of the other kind of things that I wanted to kind of talk about that we do really well here is we've instituted a journal club where we want to be able to demonstrate your learning, to continue with the lifelong learning. So it's a very robust experience where our residents spend time going over literature in an analytical fashion through the tools you learn in biostatistics and epidemiology, so you can really learn to understand how to overall view, rate, and grade research. It's a academic focus, actually. It's probably different than what you're used to in medical school, and our residents really become fine-tuned at that and really begin to have strong skill set for understanding research pitfalls and strengths of research. So that's kind of one of those lifelong skills that you'll develop and go on to really have import as you continue your career, so that you can make sure that you're keeping up and reviewing things appropriately. We also have, again, this interdisciplinary nature with our other ancillary students here at the Rocky Mountain Center. So you get the opportunity in academic setting to go out and do these projects and really learn, again, the strengths and weaknesses of each of our specialties so that we can learn how to rely upon them, how to use the work when you're out there in the profession, and appropriately utilize those skills and tools that you either won't have the opportunity to do yourselves, or you'll need to have that additional expertise. I want to spend just a little bit of time talking about Utah as well, what it's like to train here in Salt Lake City. I kind of already mentioned the University Medical School. It really is a very powerful institution, and I think the collegial nature of it you'll find refreshing, really good opportunities to learn from other specialists. Salt Lake City has turned into a really fun place to live for many of our residents and faculty, and we choose to stay here for that. If you haven't been here before, you need to kind of take some time in looking at some of the videos and images of Salt Lake City. Our school itself is propped right up against the mountains. It's a four-season climate. It's really pleasant summer, fall, and spring climates. In the wintertime, we have, I think, really some of the finest snow sports that you'll ever find in the world. We hosted the 2002 Winter Olympics here, and the venue's really exploded since that point. Some of my residents, when I queried them before doing this video, I asked them, what are the other things you like about Salt Lake City? And it came up that the cultural attributes are much greater than most people would have recognized. There's symphony, ballet, opera, lots of clubs, restaurants, night clubs and bars that a lot of our residents really spend a good time socializing throughout. There's sporting opportunities beyond the mountain sports that I've already kind of mentioned, whether it's skiing or snowboarding, world-class mountain biking right in our backyard as well. Hiking is really just gorgeous. Within short drives, you get to see some of the most iconic landscapes in the world in southern Utah deserts. And the residents say that they really have an opportunity to enjoy the city in terms of the social aspects and in terms of the neighborhood aspects of Salt Lake City. So I'd encourage you to spend a little bit of time learning more about Salt Lake City. Some of the changes that have occurred over the past couple of decades really made it much more cosmopolitan. One of the things that is very convenient, of course, too, and we take care of this clientele, is Delta Airlines as one of the major hubs here in Salt Lake City. So getting in and out of Salt Lake City, no matter where you're going in the country or the world, is really almost as convenient as any places you could imagine. You get limitless flights almost in terms of from here to anywhere in the country. So overall, I just wanted to kind of leave you with the impression that the training here really has some very unique aspects that give our residents the opportunity to excel in the field. Our residents are recruited a lot for specifically some of the skill sets that they know we have strengths here. I think if you come to our program, you'll leave here with top flight clinical skills and opportunities to work in any of the domains within occupational medicine. So that's kind of a brief nutshell overview of our program. Hopefully you'll find this to be somewhat helpful. I'll be glad to spend more time talking to you at our interviews as well as other times as well. So thank you and goodbye.